that on there. Good. Okay. So next what I want to do is get these things ready. And I forgot to pour my sterile water, so I would call an assistant to come and help pour my sterile water for me since I'm in the throes of getting everything ready.
Sure.
Sorry about that, Pamela.
That's okay.
And she would lip it and then pour it.
Flip it and then pour it.
Awesome. Got that about halfway full. Okay.
Do you have any pain right now? No.
With this.
Do you have any pain?
And that one got a little off the corner there, so I'm not going to use that one. Okay, so the mask I should put back on in between switching that and then putting that back on. So I'm going to make sure those are wet. And ready to go. And so I'm going to wash around, get any crusties off. I want to make sure to make only one pass, and I don't want to go, I want to make sure I'm going in to out, so I'm not bringing any of that gunk from the inside onto, but the inside is the most sterile, so I'm trying to go away from the sterile part.
So we aren't docked if we
And make sure that it has a face
fix
shield.
well, maybe a little bit.
Where the entire procedure went in down with the
And
trach.
then
But I'm not going to do it.
I'm just going to clean it out again there. Okay, so I am okay with how clean that is. I think it looks good. And I should not have used this hand. So,
Do you need gauze?
I need a new gauze, please, assistant. So I'm just going to throw these away because they're no good, and I want to make sure I keep my sterile hand up in the air. And she's going to open that for me. Thank you. We're going to try it one more time. Let's do it again. Alright, I'm just going to use this gauze to pat the area dry. Okay, so next thing I want to do is apply the new dressing. And now it's important to make sure to keep this middle line of the dressing sterile because that's what's actually going straight up against the patient's trachea site. Okay. I'm going to actually move this out of the way just a tiny bit, just so that I can really take this off your head too real quick, Pamela.
Wash my hands again.
As close as I possibly can to not touch that middle part to anything until I get it up to the base of there. Are you comfortable, Pamela? Is the gauze bugging you at all? She nods her head no. Okay, so now I have the gauze placed. My hands are no longer sterile and I can clean up. The last thing I want to do is replace the patient's neck strap. So I'm going to call in my assistant to help me with that. And I'm going to switch gloves and wash my hands really quick just to make sure my hands are clean because the strap is kind of something that the patient might touch or other people might touch without gloves on. So. Oh dear.
So how do you want me to do that this time?
I'm putting gloves on because we're going to be monkeying pretty close to her
Well,
trachea site.
I don't know if there's I think it's a good idea for me to remove this side first because I think it's kind of
Is that the
a little
funny
bit
side?
broken. Yeah.
Okay. And I would dispose of the bio bag in an appropriate manner according to hospital policy.
I'll hold on to it. You want to hold on to that one more? I don't want this higher.
Okay, I'll put my set on first, if that's okay.
Again, I'm gonna wait at least 30 seconds before I begin suctioning again. No more than 8 centimeters,
I believe I have
and not
everything.
suctioning for more than 15 seconds at a time.
Knock knock.
Now we're gonna
Hi,
make sure
Mr.
that
Z.
the
How
neck
are you
strapping
doing?
is comfortable for the patient, and then
My name is
about
Kendra, and I'm
1
your
finger's
nurse
width
today.
away from the neck to ensure that
So
there isn't
I
any
see
skin
that
breakdown.
you're very well and that you're
Thank you so much.
gambling. So we
Get
are
her
first assessing your trach.
oxygen back on.
Your trach.
And now that
are you
her
having any
stats still
pain?
look good after all this, so I'm going to turn her O2 back to what her order is at. Down to.
So before we go through the
Okay, so I would make sure
I'm going
to
administer
do
some
mouth
meds for
hygiene
you.
at this point because
Make it a little more
it's an important thing. You would
Okay.
use a sponge to clean out
Can
the
you tell me your
patient's
name
mouth.
and birthday?
And now to make sure that Pamela has her call light.
Okay. And then I'm ensuring
See if she
that-
has any questions. I know she can't talk right now, but we can, use a wipe or some other way to communicate, just to make sure that she's
I'm
comfortable
going to
and
lift
make
your
sure
bed
she
to
also
a good
doesn't have any pain
height.
at this point.